Hello everyone, I'm Dr. Lu Mingjun, an Orient medicine practitioner and pneumologist. Today I'm here to introduce to you my system of Orient medicine diagnosis, the Lu Yiqing Medical Diagnosis System, which is based on traditional diagnosis methods such as observation, listening, questioning, and post-checking, combined with the principles of Chinese astrology. 5 elements and face reading inform a unique diagnostic system. In modern times, many people rely heavily on medical instruments for diagnosis, lost the basic competencies that should have been possessed as a doctor. Today, I will demonstrate to you some cases where diagnosis can be made simply through photographs, allowing you to experience the magic of observational or facial diagnosis. Albert Einstein is a figure known to everyone, though the photo may be old and not very clear. Using tongue and facial diagnosis, we can see many issues clearly. Analysis of Albert Einstein's tongue. Number 1. The tongue is red and dark, small and hard, with a rest tip, indicating stagnation of qi and blood stasis, with inflammation and heat. Number 2. The center line of the tongue tip is raised, indicating constriction of the trachea and the coughing. The front area of the tongue tip shows inflammation due to excessive qi stagnation, resulting in excessive accumulation of qi and blood in the head, leading to impatience and impulsiveness. Number 3. The overall appearance of the tongue is dry, indicating deficiency of body fluids and dry cough. This is a very typical insufficiency patient with heat. Therefore, sleep is also poor, with difficulty falling asleep and many dreams. Physical energy is also poor due to the overall consumption of qi. This is a significant depression in the lung area, indicating lung deficiency, with visible cracks, indicating it's a lung problem disease of at least 10 years. Also, he has rhinitis. Number 4. Swelling and hardening on both sides of the liver and the gallbladder area indicate metabolic problems in the liver with heavy accumulation of toxins. Dryness of the tongue and rhinitis are most caused by long-term smoking. Number 5. At the same time, there are also many cardiovascular and heart problems, poor function of the spleen and stomach. According to my theory of correspondence between the front and the back of the body, although the root of the tongue cannot be seen, there are obvious problems with the reproductive and urinary systems. Myocardial hypoxia. This is a preview to my upcoming tongue diagnosis course with Lotus. Usually, students who have studied with me can accurately diagnose Albert Einstein's tongue after just 2 classes. Now let's move into analyzing Albert Einstein's face and do a little diagnosis. Number 1. According to the overall facial appearance, Albert Einstein's face belongs to a relatively intelligent and slightly long lifespan type. This type of face is suitable for a career that can gain reputation worldwide. Number 2. At the same time, it indicates difficulty during childhood and middle age. Also, he has many disagreements with siblings and all close friends. Number 3. Overthinking, poor mental state, slightly imbalanced on the nervous system, unfavorable marriage fortune, symptoms of depression or mania, very poor fortune in terms of having children. Number 4. From his face, we can see inflammation of the heart and the lung. Hepatic and gallbladder disorders are also very obvious, just like rhinitis. Gastrointestinal system is not so good either due to overthinking. He also has hernia. He has very poor fortune later in life. This is appearance of loneliness, and there is already some cancerous growth, as well as a very poor mental state. Number 5. Albert Einstein's best period of fortune should be between 40 and 50. Before the age of 28, there was a lot of instability and moving in life, and in his 30 years old, there was even more disturbance. After 50 years old, overall health and living conditions were at their lowest. So, although he was a great scientist, from his face, we can see his life was full of turbulence, instability, and setbacks. My loose itching medical diagnosis includes tongue, face, ear, hand diagnosis, and buds and feng shui disease diagnosis, etc. It can not only comprehensively diagnose the cause and the mechanism of disease, but also allow doctors to understand the patient's personality, family relationships, susceptibility to disease, and the fortune of the year, thus providing more targeted helping disease treatment. Thanks to Iluto's generous invitation, I plan to give 2 webinars. The first is TCM tongue diagnosis of common respiratory diseases on May 1st, 2024. In this class, we will discuss why do many people have a persistent cough. Is it due to pharyngitis? Or is there an external cause? Or is it already pneumonia, bronchitis, or insufficiency with excessive heat, bacteria and viral infections, etc.? This class will not allow you to quickly differentiate the causes, but also witness changes in the texture of the tongue coating after acupuncture treatment, giving you more confidence in your diagnosis and treatment strategies. The second webinar is TCM face diagnosis of cardiovascular and pulmonary diseases on May 9. Many doctors rely too much on medical equipment for the diagnosis of cardiovascular disease, coronary heart disease, and pulmonary diseases. I have many patients who, after experiencing scary heart discomforts and call 911 for emergency treatment, only to find that all the results are normal. So many patients with heart problems now come to my clinic directly for emergency treatment. Many patients with obvious pneumonia and asthma can be accurately diagnosed through facial diagnosis in Orient medicine before Western medical instruments identify the root cause. After learning from my class, you will be able to observe people on the street and instantly know whether their cardiovascular and pulmonary functions and health and how long they have been ill. I'll put the link to register for the courses in the description below. Please like and subscribe my channel for more face and tongue reading videos. Thanks for watching.